So hello, my name is Vasha, grade 9, school name Kamala Subramaniam CBSE Secondary School. So now we are going to see the model or project of blood transfusion versus iron transfusion. So let's come and see my creativity. So these are the two patients for our model now. One is blue and another is violet. So, blood transfusion versus iron transfusion. So, the equipment needed for a person to do blood transfusion are blood recipient set filter, tumbling with drip chamber for blood or combined set. This set are being intimated for these two patients in this model. So, you can see the blood bank is connected with these equipment. So see this can be said as the bonded recipient set and rubbing to for the chamber of blood or combined set. This is the set that which the equipment needed for a blood transfusion. So now we can see shortly about a blood transfusion. During a blood transfusion, the blood flows out of a hanging bag. See, when a blood transfusion is occurring, the blood bag will help me. The blood bag is hanging with the flow. So now into the tube. Through another tiny tube into a blood vessel into the bloodstream. This will occur when a person gives blood and this goes down when a person needs blood. So, for example, whose process takes about 1 to 4 hours depending on how much blood is given. This is for 1 unit. If 2 unit, 3 unit is there, we have to take the time taken will be 4 to 8 hours, 8 to 10 hours. It will be 1 day for 10 to 12 units. Next, in this blood bag contains 3 bags, 450 ml, 250 ml and 550 ml. So next we can see that what are these equipment done in our body. So see, this is known as a tourniquet which will be handed in your arm for the syringe of butterfly needle to donate blood for your body needs. So what are the blood transfusion reaction that needs to you are it is an acute disease. It is not a chronic disease. When you are donating blood to someone, it will help you. It won't make you weak or destroy nothing. So for the blood transfusion reaction classifies that symptoms appear within minute or up to 24 hours post the transfusion. There won't be delayed transfusion if the symptoms will be anxiety, chill, flushing, itching, shortness of breath, chest pain. These will be the simple symptoms of blood transfusion. So see, what are the helpful hints that I am going to give you right now. Prior to transfusing blood, it is important to follow your doctor's order. Without not consulting the doctor's order, you should not do the blood transfusion. Next, follow the instruction policy or type and crosses match. Typically, blood products are checked by 2 licensed person. The people cannot donate blood as easy how much they have. The people who are donating the blood, they will be tested by hepatitis, HIV, cancer, some of the disease that are which chronic. They are not acute. If they are having acute disease, they can give a blood after 6 months. So, we have to follow instruction policy for checking vital signs. Be alert to set signs of blood reactions. So, next our topic is going to be related to blood, that to save blood. So, now if you come here, the World Blood Donor Day is about 14th June. So, if you donate you donate blood, you can save someone's life and you can be a hero. Eligibility requirements to donate blood are: be in a good health, be at least 17 years old, weight about 45 kg, have a heart of gold. Main thing to have a heart of gold. Next, what are the benefits? What are the benefits of doing blood donation? Your weight will be reduced and your cells will be refreshing, and you cannot lower the risk of heart disease. You don't prevent with cancer. So what we have to do? Do not do blood if. So to donate blood, if already I said you are between 18 and 65, your weight is 45 kg or then more, your hemoglobin is 12.5 gm per gram percentage or more, it should be not in single digit. Your last blood donation was at least 3 months earlier. You can do thrice a time in a year. Next, you are healthy and have not recently suffered from jaundice, malaria, typhoid, other transmissible diseases. Do not donate blood if you had a major surgery in the last 6 months. You are heart patient or suffering from high blood pressure, epilepsy or diabetes. You are not permitted to donate blood. You have a history of cancer, anemia or bleeding. You have a cold or a fever. You should not donate blood. If your cold and fever has been cured, you can give after 2 months or 1 month with the doctor's recommendation to donate blood. Next, you have received a vaccination in the last 24 hours, also not permitted to donate blood. If you are vaccinated and if you are donating a blood to this violet, what will happen? He will also suffer from a disease or any infection which we have to him. So that is very important. You should not donate blood within a vaccine or you are suffering from any disease that is acute or chronic. You are not permitted to donate blood. This is so important. Your disease will also suffer from other disease. There is no profit to donate blood. So please notice that important to every blood donors. Next, you have a history of alcoholism, drug addiction, you have had a miscarriage last 6 months or pregnant or anything that which you have been you suffered. So there are eight blood groups, that is A positive, B positive, AB positive, O positive, A negative, B negative, AB negative, O negative. So I am going to introduce a new blood group. So what this, can you find it? You won't hear it about. Let's go into that. It is known as Bombay blood, or it is called to be HH blood group. What? It is new about to hear it, right? Let's move into this. So what is Bombay blood group and how it's discovered? So let's go into this. So it was discovered by Y.M. Bent in 1952. Why it was discovered in Bombay means most of the people who are in Bombay have been having the Bombay blood. For example, in a city there are 8 million people. In that 8 million people, only 2 people will be suffered with Bombay blood. So I have a story with me. A child who was 13, he was a Bombay blood. He was a Bombay blood. He don't get blood from any one of them, so he died. So this blood was a critical risk and it was not found most of the people. So see, this is O positive blood group. See, it has more ribosomes, dead cells, everything it has with a thick and normed. But if you see Bombay blood group, it is phenotype and antigen. It does not have nothing because it is a combination of A, AB, A and O, B, AB, B and O, only AB, AB, AB and O. So these only some things we can say only some, we can say that A positive, A negative can donate, but it will be a risk of something. It said some, if O positive blood group has infections or disease, they will also be suffered. But if they don't have any disease, if they also donate to the Bombay blood group, they will also be suffering from anything like rashes, everything they will be suffered. So now we are going to learn what we are going to talk about iron transfusion. So what are you thinking about iron transfusion? An iron transfusion will do for a pregnant ladies who has a weak body, does not have any fatigue, who needs a boost of hemoglobin. They are all need to do iron transfusion. So who should have an iron transfusion? People who suffer from iron deficiency, anemia, and do not respond to or cannot tolerate oral in iron therapy may benefit from an intravenous iron transfusion. This is a referral service. Talk to you GP or make an appropriate at the NIM clinic today. If you don't have any anemia or you are a weak body, you can suggest someone or you can do iron transfusion. Don't think iron transfusion will make you suffer. It is a profit, but you will have the symptoms cold, fever, like a general thing that which we will affect like in rainy season or anything. But blood transfusion does not have any symptoms. It is good for health because it makes several important facts. So see what are the health benefits of iron. So treat anemia, boost hemoglobin, reduce fatigue, boost immunity, improve concentration, restore sleep. So see, these two images are the people who does not have iron infusion. So they one hand become thin and another was fat because she didn't have any iron infusion or iron transfusion, so its hemoglobin level has been decreased. So this will be that skin was like a rashes with some time, so it also has a fatigue. So compare these. Iron transfusion is best for the people. So don't think that iron transfusion does not make your body weak. It makes your body strong. So friends, I have taught you many things I think so. So please donate blood and save many of the lives and be a hero.